Hi, this is Dr. Jared Garris. I'm the Glenn County Health Officer. I'd like to do a weekly review for July 1st, 2020. So I think probably most people are aware, but we have triggered with the state. So we have kind of gotten on their naughty list, so to speak. And there's two reasons why that is. Our metrics have fallen out. We have per capita, per the number of residents in Glenn County, we have too many cases for that, and we've got a total of 33 cases right now, and so that's above the metric. And then we've also got a high percentage of tests that have come back positive, and so those two reasons are why we're on that naughty list. So what does this mean? It means that all bars and pubs are to be closed down. For restaurants, there are no indoor dining, outdoor dining, and takeout. CDC says that getting takeout food is a safe thing to do. Low chance of contracting COVID-19 from that. Family entertainment centers that are indoors are supposed to be closed, like bowling. Sorry to hear that for Orland Bowl. And then we've got some other things that don't pertain to our county. This temporary shutdown will be for 3 weeks. So where are these cases coming from? Well, we've been saying that we've got some clusters. Well, actually just today, it looks like maybe we linked some of those clusters together. We've got some fantastic tracers that have just been doing a phenomenal job. And it looks like maybe we've just got a couple of clusters as opposed to the 5. Where are those clusters originate? It's private gatherings. So it's graduation parties, it's anniversary parties, it's block parties. It's people just getting together and hanging out. And that's where we're getting most of our cases. Travel, some, and work sites, some. Reality with the work sites, carpooling is a dangerous thing to do right now. You're going to be in a closed space for more than 15 minutes. And then the other thing that I think sometimes people don't think about is in break rooms. Break rooms are dangerous places with COVID-19 because we take off our masks, we're in close proximity, and usually for more than 15 minutes. And that's a killer for COVID-19. I will say that almost all of our new cases are linked to people who have known cases. I mean, this is the vast majority of them. Aren't real big surprises that they are testing positive. So what are we doing about this? Well, we've recognized that most of the cases are coming from the North County and that it's primarily the Latino community. And so we're going to be doing a lot of educational information that we're going to be sending out directed towards that group. That's going to include things with social media. We're going to be taking out some radio ads. We're working with Listos, which is a group that does emergency preparedness things, and they're going to be helping to take around some flyers and some posters and things. We're working with the schools. We're going to be utilizing their mass email system. We're going to be asking local businesses to help spread our word. We're going to continue working with churches. We've been working with them before, but we're going to try and increase that for getting information out to the community. And we'll also continue collaborating with all of the local providers here in Glenn County and making sure that we have a very unified front and making sure that it's very clear about COVID-19. What else are we doing? So at the health department, we've hired 10 additional tracers, or have trained 10 additional tracers. We're currently monitoring 158 people. We have better than 90% of our cases. We can say where it was that they contracted COVID-19. We've hired an additional nurse, and we are actively recruiting for another nurse. We've changed some job duties, and we now have 4 runners. Those are people to try and help keep people with COVID-19 at home. So bringing the masks, thermometers, doing what we can to try and keep those with COVID-19 at home. What else are we doing? So we had a conversation with the state today. We're requesting another testing site, kind of like what they have over in Chico at the Silver Dollar Fairground. We're requesting to have one put in Orland. We're also working with the state. At present, our tests that are being done in our area, majority of them, it takes 6 or 7 days to get the test results back, and that's just too long. We need faster turnaround time. So we're working with the state to try and find some additional options. And then the other thing we're doing is we're trying to work with our businesses to try and help increase the use of facial coverings. Some good news. We don't have any cases in the nursing home, and I think that that's fantastic news. That's the group that is for sure at the highest risk of death with COVID-19, and we don't have any cases. Just this within the last 10 days, we have tested every person who works in the nursing homes and every resident in the nursing homes to make sure that there is no COVID-19 in the facility, and there is not. And we will continue to check every week, a quarter of them, so that if we do have a case that gets in there, that hopefully we can stop it as early as possible. We do not have any in the assisted living facilities, and we've been working with the assisted living facilities to try and make sure that we're keeping it as safe as possible. And we don't have any cases in the jail. There's been no increased use in the ambulance, which is good news, and not that we want to utilize it, but but right now there are more beds available than there was prior to COVID-19. So there's lots of beds available within the hospital. Once again, not that we're hoping to use it, but it is good to know that we have those and lots of ventilators, and so we can handle some people getting sick. So what can you do? This is not a new message. Stay in place. I know we've got the 4th of July coming up. If people can just stay with their family that lives in the same roof, under the same roof, if they can just stay with that group and not make it a big group, that really does a lot for decreasing the spread of COVID-19. The large group gatherings, it kills us. It's killing us. Maintain your space. That's 6 feet apart. You're probably about 6 times less likely to develop COVID-19 if you can be 6 feet apart as opposed to just normal interactions. That keeping your distance really does work. And cover your face. The evidence behind the facial masks just continues to grow. It decreases the spread of COVID-19. And then lastly, if you get sick, if you're feeling sick at all, stay home. Don't go to work. Don't go to large group gatherings. If we can do these things, almost all of our COVID-19 goes away. Talking about that better than 90%, we know where they got it. Those, each and every one of those cases were in close contact, less than 6 feet, for more than 15 minutes without a facial mask. Each and every one of those. If we can do these things, we can make COVID-19 just about go away out of our community. I hope this was helpful. Thank you.